Alrighty, let's go ahead and get started. So welcome everybody. We've still got folks trickling in, but for the sake of respecting everyone's time who's here, we're going to go ahead and jump on into the content. So welcome. We're really happy to have you guys here. Happy Friday. I hope you guys are all hanging in there. I know that it's been another week full of police brutality and racially motivated hate crimes, and I know that my heart just feels completely exhausted. And so, I can imagine that we're all feeling that way. And so I just want to encourage you all and say that I'm really grateful for you. I know that doesn't help relieve the exhaustion or the burden, but just want you to know that you're valued and that we're here. If you need anything, please always feel free to reach out, even if it's just to vent or whatever it is that you need. Please know that you're not alone in this. And so with that, just a couple other logistics for today's webinar. Please type your questions into the chat if you have any. There are going to be times throughout probably that it's just fine for you to unmute yourself too to ask a question, but we would recommend the chat is the best way to ask questions, the quickest way. And if you're not actively presenting or asking a question, then we ask that you just please keep your microphone on mute. And so with that, and then also, I think you guys are all aware of this, but just a reminder that slides will be available. They are available currently on the shared drive, and the webinar will be recorded and uploaded after we're done. So with that, let's look at our agenda for today. So pretty typical agenda that we've got here. We're going to have some shelter updates. Then we're going to talk about a few system updates. Then the health department has graciously agreed to come and talk with us again, and they're going to give us some updates about the kind of state of the virus and some reminders of protocol. And then we've got some resources that we want to share with all of you guys. And so with that, I'm going to turn it over to Lauren Licata, and she's going to talk to us about our shelter updates.
Good morning and happy Friday, everyone. Let's talk about some shelter updates. Currently in the interim shelter, we have 0 symptomatic clients in shelter type 1, and we have 37 positive clients in shelter type 2. This does contain some larger families, so it is a big number. And we're going to talk a little bit about the uptick that we've seen in positive cases. So. Next slide. Because of the uptick that we've seen in positive cases, we wanted to remind everyone of the client screening. Please continue to screen clients for COVID-19. Use the screening tool that is attached here, or there's a screening tool on the CDC website. You can find them really anywhere online to monitor client symptoms daily. Any clients displaying symptoms of COVID-19 should be transferred to the interim shelter. And if you need to transfer a client to the interim shelter, please call CAM at 313-305-0311 to get them transferred over.
Lauren, what was, I know you said that we were at 37 now. What is the highest we've been at recently? It got a little higher than that, didn't it?
It has, back in the beginning of the year, I think we were at like 80, so.
Oh, sorry, I meant in this recent surge. Didn't we get up to 50 at one point recently, or am I misremembering?
That is a good question. I was out for a couple weeks, so it could have been when I was out, and I do not know. I'm sorry.
Okay. No, that's okay. That makes sense. Thank you. All right. From here, we're going to jump into a few system updates. I'm not seeing any questions come in the chat, so we're going to go ahead and keep us moving. So the first update is we just want to make sure that everyone is aware we've been providing continual updates on vaccines for housing staff. And now we just want to make sure everyone knows vaccines are available statewide for anyone ages, I believe it's 16 and up, to receive a vaccine in the state of Michigan. So this applies to all of our housing staff and all of our clients. Everyone is eligible now, well, all of our 16 and older clients, but everyone is eligible now to receive a vaccine in the state of Michigan. And so we just really want to make sure that you're aware of that. If you're still lacking your vaccine, you've been trying to get it and you really want it, we've got a couple options on these 2 slides for how you can schedule to get a vaccine. And so we just want to make sure that everyone knows it's open now. There shouldn't be any like needing to give rationale for why you deserve a vaccine. You should be able to hopefully schedule it. It's just then waiting for the scheduled appointment. So the first one that we want to make sure you're aware of is that you can get a vaccine at TCF. To schedule an appointment for the TCS Center, you just need to call the number on the screen Monday through Friday, 9 a.m. to 6 p.m. I do also think they're doing Saturday vaccine clinics now. And so I have a link to their website here on the slide. Let me see if I can copy it for you guys. And so there's more information about vaccines on their website. But again, this is now open to any Detroit resident who is 16 and older, or any person that works in Detroit that has to work at their job site. So this would apply both to our clients and all of you providers who are in the field working directly with clients. And then the next place that I want to make sure you guys are aware of is Ford Field, which is also here in Detroit. And so this is being put on by the state. Anybody in the state of Michigan can utilize this site. Actually, it's being put on with like FEMA funding, and then the National Guard is helping to put it on. And so if you want to schedule an appointment, you can do so through a number of ways. You can click on the link in the slide, which I will copy for you guys. You can text "End COVID" to 75049, or you can call the phone number that's on the screen and press 1 to schedule an appointment. Their hours are a little bit more expansive. I think they're doing every single day for like, I think it's roughly like 12 hours a day that they're doing vaccines daily. So that's exciting. This is where I got my vaccine. For folks who are wondering, I signed up, and then probably like a week or so later, I got, I signed up to get an appointment. A week or so later, I was reached out to schedule the appointment, and then I was in a day or two after that. So it worked out pretty smoothly. Would definitely recommend. And then there's plenty of other places that you can schedule to get a vaccine from, but we just wanted to share these 2 big ones with you guys so that you're aware. Both for yourselves, if you haven't got a vaccine yet, we encourage you to look into these 2 resources, but also we just really want to make sure that you guys are still continuing to engage with clients about vaccines, especially to our PSH and our rapid rehousing providers. We really hope that you guys are continuing to talk to clients about the pandemic, talking to clients about vaccines, vaccine availability, educating them on the vaccine, and then helping them, if they're interested in getting a vaccine, to schedule for an appointment or to get on the wait list for an appointment. And then if they need help getting to the appointment as well, we hope that you guys are working closely with them for all of these things. And so that's really kind of all we have to say about that, but just wanted to make sure you're aware it's open to everybody now, which is great news. And just please keep working with clients on this. We also just wanted to briefly talk about the United Way grant. It ended on March 31st, so we closed out the grant now, and it went really well. And so we just want to give a huge thank you to everyone who requested assistance for furniture or for landlord incentives for your clients. So at the end of the grant, in total, we assisted 30 households, which is exciting. We helped 30 households with furniture, and 4 of those households we also assisted with landlord incentives. So furniture was by far the more popular item on this. We spent a total of $18,374 on furniture and $2,000 on landlord incentives, coming to a total of $20,000 in just around like a month or 2 of having this funding. So I think the biggest takeaway about this funding was just it was very clear through this that furniture and household furnishings are a huge need for our clients and for our community. And so we've been having internal conversations at hand about ways that we can try to just like find this resource for a more long-term basis, to provide this resource more long-term to the communities. If folks have ideas, always feel free to reach out and let us know. We're going to keep brainstorming at hand, because we definitely saw that this was a major need. One of the ways we're going to brainstorm is we're going to reach out to United Way and see if there's any more long-term funding we can get, as they see like how popular it was here in the short term. But we definitely we knew that this was a need before. We think that having this grant available really solidified and gave us like tangible evidence of how big of a need this is. And so our hope is to try to meet that need moving forward, because we know how important it is to have furniture when you move into a new unit, to help that place feel like home and to help you feel like you kind of got a foundation to get off of your feet. We also use this funding to provide frontline pay, or like hazard pay, or just bonus pay to persons who, to our providers who in the non-congregate facilities who've been working face-to-face with clients during the pandemic. So we were able to provide that assistance. I don't know exactly how much assistance that shaped up to be, but I know that we were able to partner with all of you guys directly to give that, and we hope that that was something that was useful as well. So those are some of the kind of quick overview of this grant and some lessons learned. And so we're hoping to continue to find ways to provide assistance like this moving forward. And we thank you all who requested this assistance and used it to benefit clients. We really appreciate all of you guys. And so from here, I'm going to turn it over, I believe, to Katherine. Actually, I don't see, I'm not seeing Katherine here, but is there someone from?
Hey, Katie, I'm going to
speak.
speak. Yep, I'm going to go ahead and speak to this. Sorry.
Perfect. Thank you. I was trying to
unmute button.
That's okay. I was trying to search the guest list and talk, so it wasn't going well. Okay.
Oh, no problem. Hi, everyone. I'm Paige Beasley with CAM. So I'm actually speaking in regards to the HCVs. As you all know, hopefully you all do, there have been a significant pool of HCVs from the wait list so far in 2021. That number as of today is 382. So what we do know is out of those 382, 258 are still active in our system in outreach, whether shelter, transitional housing, or rapid rehousing programs. It is expected that MSHA will continue pulling as we continue populating the list. So please continue to look out for that. So high level goals. We are anticipating on doing 100% of households who are still in the CoC program. And that's SO, emergency shelter, transitional housing, RRH, those programs. So at the time that they are pulled or offered assistance with the voucher paperwork by their case manager, we are also anticipating that 80% of the households that are still in a CoC program at the time that they are pulled leased up with a voucher. So currently we are at about 65% of the paperwork, the initial paperwork from MSHA are actually turned into the agents. So that is extremely that could not have been done without the support of the you guys, the service providers. And so huge kudos for that, collecting the paperwork. And so just also want to let you guys know as well that the CAM navigators are working with people who are in shelter to continue to complete the HCV apps. Rapid rehousing providers, if you have anyone in your program who needs to be added to the wait list, please complete those pre-apps and send those in as soon as possible. Next slide, Ms. Katie, thank you. So just wanted to talk about really briefly in regards to the HCV process while you're assisting the clients. So in regards to denial notices, many clients either they have or they will be receiving some denial notices in the mail. These are not final denials. I repeat, these are not final. And an informal review should be pursued in all cases. So if your client does receive a denial notice, then they definitely should contact MSHA for a review of their case, because that is not the end all be all, and they can go under a review. So many times these denials are just simply because they have not submitted all of their supporting documentation yet. So it is very important that we get everything submitted, those documents. In regards to supporting documents, so many people are currently in need of the supporting documentation, such as the income verifications, the proof of birth, social security cards, and etc. But we are asking that in any way possible that you guys can assist these clients in making sure that they keep the MSHA agent in the loop of things as well, especially if you're working on obtaining a document and it's requiring more time, like more time is needed. Also a little tidbit, if you guys want to let clients know, if they go to their MSHA DHHS office and speak with their worker, they may be able to get a printout from their office that includes the name, date of birth, and social security number. We have been told from MSHA that we will be able to use that. That will suffice in place of a birth certificate and the social security card. So help out a lot of clients as well. In regards to the attendance at the briefings, looks like we are asking that you ensure that all the clients have the information about their briefings. And when it comes to the date of the briefing, that they have transportation to get there, or you guys can actually go with them to the briefing. It's very important that they don't miss their briefing day. If anything happens and they do, you want to get in contact with the housing agent as soon as possible as well. Searching for units is going to be extremely important. As we know, the housing stock in Michigan is becoming really, really tight. And so we are asking that you continue to assist your clients as early as possible in the process with locating properties and locating housing, and hopefully identifying something by the time of the briefing comes. And finally, just an update, if you guys have not heard just yet, HAND, the HRD at the city, and CAM are working to plan trainings for providers and office hours with the MSHA agents. You should have received the email about the office hours. If you have not, please check with your agency's HCV point of contact for the information. We have one scheduled at the end of April. It will be the opportunity to ask the MSHA agent specific questions about clients and get some clarifications on any necessary steps, just updates in general. So that is about it. Let me see if there are any questions. Is there any way the agencies can be notified of briefings are taking place? So briefing information typically goes directly to the client. I will check with Katherine. She is the liaison for the MSHA agents here at CAM. So I'll check with her and see if they're going to be sending out a correspondence to us as well.
Hi, good morning. This is Jasmine. I'm Jasmine with HAND, I'm sorry. If you would like information for your client in terms of the briefing, that's the reason for the release of information. And so once we get all of those over to the agents, we'll have more frequent communication about the actual client process.
Thanks, Jasmine. Any other questions, guys? Absolutely, Deja. I agree. Deja indicated that's the best way to help the clients in attending. So yes. All right. Thank you, guys.
Thank you, Paige.
Any other questions, you can definitely give us an email or a call.
Wonderful. Thank you. And we'll keep probably having updates for you guys as the weeks go on as well. So probably not the last time by any means that you guys are going to be hearing about HCVs. And so from here, I'm going to turn it over to our colleagues at the Detroit Health Department, and they're going to talk to us for a bit about some updates.
Good morning, everyone. Can you enable slide sharing capabilities, Katie?
Yes, you should be able to share now.
Okay. I think the other sharing needs to end, and then I can share mine.
Oh, I ended the slideshow, not sharing. I see what I did. Sorry. Thank you.
All right, good morning again, everyone. My name is Japari Gizama, and I'm actually on the line with, I think one other nurse is here who is part of our team. And as well as, I want to say Kelly is on the call. So if you all have any questions and you want to put into the chat, let us know, and or put it into the chat and we can definitely respond. I do want to go over what's going on in the city in regards to COVID-19, the vaccine efforts, and then kind of what we need to do. I'm gonna probably make this as transparent as possible in regards to our conversation today, but Detroit, as many of you probably have heard via, talking to other individuals or from the mayor, we're not doing too great. The numbers are continuously increasing. Unfortunately, they will probably continue to increase for the next couple of weeks. We know that the mayor held a press conference on Wednesday, and he discussed how the cases continue to are coming from the thumb part of the state, and are pretty much creeping down into the city of Detroit. And it's pretty unfortunate because we have not seen a spike like this since the start of the pandemic. So as you can see on the left side of our screen, we have a total of 41,320 confirmed cases of COVID-19 in our city alone. We've also seen a total of 1,925 confirmed deaths due to COVID-19. On the right side of the screen, this is just the areas that surround us. We know Oakland, Macomb, Wayne are the surrounding communities, and this is probably needing to be updated because this is most recent on the 14th. But Detroit is at 21% positivity. And I think the best way to explain positivity is that is the total amount of cases that are coming, or tests that are coming back positive of COVID-19. So if you want to look at it as like out of 100 tests or 100 people that are testing, going and getting their nose swabbed, you are seeing 21 of those people coming back positive. And we know COVID spreads through contact. So think of those 21 people and how that will continue to multiply as they continue to infect other people around them. So that is why we see the numbers possibly going up in the next couple of weeks. So do your due diligence, folks. Continue to wear your mask, social distance, hand hygiene, everything that we've been doing. And I realize and I understand for sure how tired and exhausted many of us are. But, this is, I don't want to say kind of like the finish line, but this is the point where we need to not let our guards down, even more so now, more than ever, because this thing we know will just continue to come back and continue to cause more problems in our community. The governor has placed a new mandate and has not shut down the whole state, even though she's getting a lot of pressure from the CDC itself. But we're hoping that we can pull through this in the next few weeks and avoid a full state shutdown again. So keep that in mind. Continue to talk to your families and friends. I know it is hard, but we have no other option but to continue to persevere. So with that, I do want to go over the vaccine dashboard. You can see here that COVID-19 vaccines have been distributed by various jurisdictions. Again, you can see our surrounding communities, Macomb, Oakland, Wayne, Washtenaw. And overall, you can see that Detroit is also trailing in this image here. We are only at roughly 25% of vaccinated individuals in the city. And we know that we need a higher number. We need to be at least at 70, preferably even 80% vaccinated for us to achieve community or herd immunity, which means that there are enough people that are immune from this disease that it's unable to spread and continue to cause illness in the community. You can see on and I'm looking at that the top numbers. Overall, the state of Michigan is at 42%. And then you can see Washtenaw County is at 49, almost 50% of their residents are immune or have had some form of the COVID-19 vaccine. So we do need to pick up our vaccination numbers, because this is also reflecting in the cases. So you can see Detroit on this previous slide here is only is having 21%, a high number of individuals that are positive. And you can see that we have a low number of individuals that are vaccinated. So just keep that in mind as you're interacting with clients all around the city, coming to your facilities. Oops, I ended the presentation. I apologize. So just real briefly, we'll go over some of the vaccine information that we've gone over in the past, but to help you as you have conversations with people about getting the vaccines. We know the main reasons why the vaccine is important is that it will help keep individuals from getting COVID-19. We know it's a safe way to build that protection, that immunity, to get that community immunity, and it will help us stop this pandemic and continue with our lives in a safe and hopefully a new normal way of living and interacting with each other. The goal of a vaccine we've talked about in the past, but just as a reminder, it provides a long-lasting protection against diseases, similar to how it's protected us against measles, it's protected us against polio, smallpox, diseases that are, a lot of them been eradicated, and some that we don't even hear of as much anymore because vaccines have worked. What vaccines do is they mimic what a disease might do. So they stimulate your immune system and help your immune system build those antibodies that we'll talk about shortly. You can get it in a shot, you can get it orally, or you can get it through a nasal spray, depending on what the vaccine is. There are different types of vaccines, and we know that they're different because they all work to get that immune system to wake up and react in different ways. So the immune system, as we mentioned, or as I mentioned, builds these things called antibodies. So whenever diseases are attacking us, which we are constantly facing germs and diseases and viruses and bacteria, our immune system is always fighting, it's always on patrol, it's always doing what it needs to do. So when a new germ is exposed to your body will create these proteins called antibodies that will remember what the disease looks like. It will catch those diseases if it's ever exposed to it in the future. So if you've had chickenpox as a little one, or if you got the vaccine, at some point you have antibodies. So if you're ever exposed to chickenpox or individuals with chickenpox, you have the antibodies, and therefore you won't break out in the rashes and the fever and all of that. Same with the flu. If you receive the flu vaccine, and the flu is a little different because it does mutate, it does change. It's a little bit of a tricky one, hence why we get the flu shot every year. But the flu, essentially, once you have those antibodies, it can always catch and trap and destroy the flu germ if you're ever exposed to it. And then we know that with COVID-19, if you don't have antibodies to it, you're really at the mercy of your body's immune system. And we have seen time and time again, people that are extremely healthy have poor outcomes with this disease, whereas you have people that might not even have a reaction to it. It's just almost like a Russian roulette. We don't know what the response is. We are getting better at treating it than we were last year. We have medications like remdesivir. They're not intubate or putting tubes down people as quickly as they were last year, which kind of backfired. But we're getting better at treating it. But in the first place, you don't want to end up in the hospital because that's when it starts getting really scary. And then on top of that, as someone that works in the hospital, you know that there are people that are regularly ill with whatever other conditions they have. So We want to prevent that overwhelming of the healthcare systems around us. And we know that each hospital in Michigan is starting to reach its capacities. Just a side note, I was downstairs in the ER yesterday evening, and there were people lined up in the halls. And as someone that's not really been in the ER or been an ER nurse, that was kind of shocking for me. So it's definitely something that should concern everyone, and everyone should try their best to avoid. So with the COVID-19 virus, we know that we're trying to create antibodies against the spike protein. So all your COVID-19 vaccines will help build the antibodies that will prevent spike protein from attacking your cells. Spike protein is unique to COVID-19, and spike protein is what the disease itself, the virus itself, uses to catch and hold on to your cells. So if we can prevent that spike protein from catching our cells, we can prevent our cells from becoming infected. And that's simply, in a simplified version, how these vaccines work. Real briefly here, we've talked about the mRNA vaccines, which are available in the city of Detroit. That's your Pfizer-BioNTech vaccines and your Moderna vaccines, which are both 2 shots. So they are both mRNA vaccines, which help your cells remember what COVID-19 spike protein looks like and create antibodies too. And we know specifically that mRNA vaccines do not alter or change a person's DNA, and rather they are just a genetic code that tells your cells what to do. And this therapy is a newer type of therapy for vaccines, and it's something that we had not used in the past. So in the past, when you had, when we used vaccines for the flu, or when we used vaccines for chickenpox and such, this therapy is newer for vaccines, but it has been studied for decades and decades. Cancer treatments have been used in the past for this, and other vaccines were studied. But so far, I think looking back as to when the first mRNA vaccine, Pfizer's vaccine, went into the arm, Pfizer's went into the arm of a volunteer or one of the participants of their study, it's been over a year. May will make it 1 year. So at least we know that individuals that got the vaccine for the first time are approaching 1 year to this time. It is encouraging to see that, they got it and they're still doing okay. We'll continue to see results and report cases of reactions to the vaccines. Here are obviously the side effects that vaccines may have or can have. And it's not to say that this is, I don't know if side effects is even the right word to use anymore, but it's basically your body's reaction, your body's way of building immunity. So a person might have pain at the injection site because you just got a needle poked into your muscle there. A person might have some tiredness, and that's because your immune system just woke itself up and is ready to go into battle. They might have a headache. I get headaches when I have just even a change in the temperature, but your body is obviously experiencing something. Muscle, joint ache, fever, chills. These are just signs that your body is building that immunity against the diseases, and not necessarily a side effect to a negative thing. So remember that not every every medication, every vaccine, medication, or treatment has some form of a effect and maybe consequence, or it can have a side effect to vaccine or to that treatment or medication that you get. 6 reasons why vaccines seem to have been brought on so quickly, because this seems to be a lot of the concerns that people have, the hesitancies. Number one, they're saying this disease was discovered just over a year ago or a little over a year ago, and today we have vaccines. These are just things to point out. So we know modern science has been very helpful. We know that we have faster internet, faster capabilities of communicating with each other. Scientists from different parts of the world can email each other back and forth, send messages, and get things done. We know that there were collaborative efforts from all these different agencies, companies, governments, all working together to solve this problem. There were lots of volunteers. We know that this disease is a pandemic, so there is an abundance of volunteers because because it's everywhere and people wanted to be a part of the solution. Even here in Michigan and Detroit itself, we know that the Moderna site, Moderna had a site at the Henry Ford Hospital where they had participants from our own city. Previous research that was done, we know that for a fact, when the first SARS-CoV-1 or SARS coronavirus 1 was an issue in 2003, scientists were able to use the information that they learned in that time to build. When we had the MERS epidemic, I can't remember exact year that was, 2011 maybe, they were able to build some more. And when this pandemic happened, they had all that underlying research that had already been worked on to get this vaccine out as quickly as they did. Available funds, many of the companies didn't have to worry about raising funds, which is something that we know everyone, you need money to be able to do things. Governmental agencies, rich people were able to contribute towards funding for vaccines and to get the vaccines out and available to the community so that the agency, the pharmaceuticals could focus on making a safe and effective vaccine. And finally, the FDA's emergency use authorization, which is not the first time that has been used. Actually, the FDA has used this emergency use authorization since 2003. And this is just a tool that they have to be able to grant authorization of use for devices for testing. So your coronavirus tests that we continuously continue to get, those are all emergency use authorization because we don't have the time to wait for an approval that takes a little bit longer. And so those are just a couple of things that help to explain why the vaccine was made available. Many of the myths and misconceptions of COVID-19 are floating around the internet. People talking about it. It's sometimes on the news. We do want to say that our team here at the health department wants to work with anybody that is ready to listen and have a conversation and hopefully provide some clarity on some of these myths and misconceptions about the COVID-19. And just for time being today, we're not going to go through all of these, but just want to point out some of the popular common ones that we've seen over the last couple months. But yes, if you've heard some of these things, feel free to message our team and ask, hey, I heard this, or this is what's being said. Is this true? Please fact check this for me. Please help me explain why this is happening. And we will be more than happy to respond and provide clarity on some of the things that are being said about the vaccines, as well as COVID-19, because we know that there's also some misconceptions about this disease that are circulating. Finally, I want to go over availability, and I won't spend too much time because I know Katie did discuss some of the ways that you can get a vaccine or encourage your clients to get their vaccines. But vaccine is available to anybody in the city of Detroit that is a resident over the age of 16, or anybody that works in the city of Detroit. It's also available to family members of workers of the city of Detroit. So it's really easy. We do make it as easy as possible for anyone to to get an appointment, to schedule one. It's just one number, 313-230-0505. And then you can click the vaccine option prompt. They will ask for your name, your address, your date of birth, phone number, email, and then previous allergies to any of the vaccinations. And you'll be given 2 appointments. Now, because we're only giving Pfizer and Moderna, you will be scheduled for 2 appointments. Please pass this on to any of the people that you interact with or any of the clients that you are taking care of. And then also, we do want to provide other options for vaccines in the city of Detroit. We know that the TCS Center is where, our hub, anyone can drive up or walk in if they prefer to the TCS Center. It's that same number. The vaccines, and I do want to point out that the Pfizer vaccine is only available to 16 and 17-year-olds and up, while Moderna is only 18 years of age and up. Community Saturdays, as well as the Northwest Activity Center. These are also sites that you can either visit yourself or encourage folks to go to. Community Saturdays are at the various sites, Second Ebenezer Church, Fellowship Chapel, and Greater Grace. Also Northwest Activity Center on Myers is available for vaccinations. Same number to call, 313-230-0505. And then I also mentioned the family day. So I, for example, was able to help my brother get a vaccine because he wasn't able to get an appointment at the time that he needed to. So he got his first shot during the Detroit Family Days, which is now available to anybody that is an employee of the city of Detroit. And they would just need to have a copy. You as an employee do not need to go with them. You just need to provide your employee verification, like a picture of your ID card or something, and your family member can get vaccinated as well. Finally, we had our first mega week. We were in the neighborhoods this whole week. It's been a long week. Many of our team members were out providing vaccinations, assisting folks in getting their shots. And today is the last day. It's currently going on at East English Village Preparatory Academy. And these are the various sites. More to come regarding this information on the neighborhoods. So call the number, or if you know someone that needs a vaccine, have them go over to 5020 Caju and they can get their shot. We'll take walk-ins as well. Finally, I want to leave you all here with, I guess, one of my favorite slides of the year, which is that it's going to take a combined effort. The COVID vaccines are definitely a powerful tool that we have against this disease that is taking so many lives and affecting so many people. But it also needs to be combined with the hand hygiene, the social distancing, the face mask wearing. I don't know about you all, but normally I get a cold at least one time, probably 2 times during the winter months. And this winter, everyone's been washing their hands, wearing their face masks, which is a good thing. But we must continue. We know COVID-19 is a little bit more trickier than your regular average colds. COVID-19 is a more advanced maybe virus versus the other regular viruses that we're used to dealing with every year. So please continue to do your due diligence. Just before I forget to say, we are available. The number that you can always reach us at 313-876-4000. We actually also have a line open for the nurses, and you can call and speak to a nurse, asking them your questions, your concerns. We know a lot of people might have concerns, especially in regards to the Johnson & Johnson vaccine that is currently on pause, that is, being investigated, being looked at, taking a more thorough look at from the FDA. And we just want to be there for you all. So please feel free to call us. Visit our website, dhdoutbreak@detroitmi.gov, for constant updates. We also have a behavioral health team. So if you all feel that this is something that we can come to your site, provide education on vaccines, talk about it with clients. We've done that in the past. We do that at some of the sites here, and we would love to continue to do that. And also, if people are dealing with stress, anxiety, depression, we will also come out and talk with folks about that. So please reach out to Katie, let her know, and she'll definitely get the message out to us if this is something that you all are interested in. And finally, I want to also encourage you that might have gotten your vaccines already or in the process or scheduled to get your vaccines, to tell your stories about your experience with the vaccines. What happened? Did the shot hurt? I'm a baby, so I'll cry when I get a shot. Did you have the fever? Did you have the chills? And what did you do? You took some Tylenol. Did it work? Did it not? Just talk to your family, talk to your friends about the vaccine, spread the word. Let's get to that herd immunity that we need to protect our neighbors, to protect our families, to protect our friends, to protect ourselves. And with that, I want to leave you all hopefully you have a lovely weekend. Be safe, be careful. And if there are any questions, I'm free to take any questions at this time.
Thank you so much, Japari. One question from me is, would you mind emailing me these slides when you get a chance, and I can add them to the shared drive for folks? Thank you.
Yes, we can definitely do that. Wonderful.
Thank you. As always, we so deeply appreciate when you come and speak with us. Everything you share is always really helpful, and we really appreciate it. I'm not seeing full questions coming in yet. I wanted to give it just a minute or two in case they did. But again, thank you. We so appreciate you coming and sharing with us.
Thank you for having us. And like I said, if in the future anybody would like us to come on site and provide, just a sit down session with clients, even staff, we are very much open to that, to have just candid conversations with people and hear their experience, hear their stories, hear their reasons for why they might want to get the vaccines or why they might not want to get the vaccines, so we can help people make the most informed decisions for themselves and for their loved ones and their families. Thank you.
Thank you. All right, folks, just the last thing we've got here for you guys is just to talk with you all very briefly about some resources that we have available. Or that we want to make sure you guys are aware of. And so these first couple of resources here, Scott was going to talk with us about these. Scott Jackson was going to go over these. He messaged me just a few minutes ago. He had to hop off for a quick emergency. So I will do my best to cover this information. Scott definitely was the expert on this. And so had better information for you guys. So forgive me if I stumble through this. I will do my best to share it. And we'll probably have this at the next webinar as well. And so then hopefully Scott will be here and can give the spiel that he had prepared to give for you guys today. So this slide, I believe, is just going over, as many of you are aware, or as you are all aware, the American Rescue Plan Act was passed a couple of months ago now. And in this latest COVID relief bill, there were a number of provisions that were addressing housing and homelessness that are providing resources to the community that we're really excited to see come in. And so there is a link that Scott provided from where NAEH gave a summary of what resources are coming into the communities, what resources we should look out for in our fight to end homelessness. And so I just put that link in the chat for you guys. And this is of course in the slides, and you guys can take a look at it later. But I think with these resources comes just a hope that we can really move the needle on homelessness and start to make meaningful steps to really making homelessness rare, brief, and non-recurring for folks, really trying to live into that and hopefully make a dent in the number of persons experiencing homelessness and helping prevent them from returning to homelessness or prevent them from becoming homeless too. With the SARA funding, there's a big push in our community right now to really prevent people at risk of homelessness from becoming homeless. And then with this bill, beyond like homeless service resources, there's also direct benefits to ourselves and to our clients. And so there's stimulus checks, which will be talked about on the next slide. And then there is also a child tax credit. So for our families, it's experiencing homelessness. This is a big resource for folks. And so there's a link to more information about the tax credit. And we're trying to research it too, to see if there's any way that we can help provide information on it. And so we encourage you guys to be researching this and working with clients to try to help them obtain these benefits. And then I see Allison just popped in the chat a link. That's wonderful. Okay, so Micah did a training yesterday for folks on understanding the child tax credit and getting access to stimulus checks, which is wonderful and perfect. And so I thank you for sharing that link. We can try to make sure to share that out with our community as well in our next listserv. So we'll make sure to send that out in our next newsletter. That's wonderful. Thank you, Allison. And it looks like I stopped sharing I stopped the presentation. So here we go. And so I would really encourage everyone to look at that resource that Allison just popped in. Also, another resource for stimulus checks is Poverty Solutions has created a really in-depth website to help folks work through, to understand the stimulus payments, to work through how to receive it, to check whether they've received it. And so we really encourage you guys to check this website out and to look at it with your clients as well. And then there's also a link on the slide for a link to the IRS's website where they're talking more about this third payment that came with the most recent round of the most recent relief bill. And then Scott had also put together a slide on some tax prep resources. I believe we've had this slide for a bit, but we just, it is tax season. It was extended to sometime in mid-May. I can't remember the exact date, but about a month. Tax season is open for about another month from now. And so we just want to make sure that you're working with clients who this qualifies for to file their taxes, particularly if clients didn't receive their stimulus payments. They can file a tax return in order to receive their stimulus payments. And there's a number of resources here to help folks with their taxes. We don't proclaim to be experts in taxes. And so we've got a number of resources linked here that we would definitely encourage you to click on, check out, work through with clients. And I know we've been trying to email some folks to potentially get some information on that we can share with you all. We did just get a reply of someone willing to have a meeting with us. So we're hoping to schedule something with them soon, and then we can share out what information we get with them with you guys. And then I think this was a slide that that was a carryover that someone else had created, just reminding folks of some other tax resources. So Accounting Aid Society and Wayne Metro. We just want to remind you, we did an information session last month that talks about the CoC. If anyone is interested in looking at that, we've got the recording and the slide deck posted for you. They're linked here in this slide. And we also still want to make sure you're aware of all the vaccine educational flyers that we have for you guys. And so just want to make sure that you guys are accessing those and engaging with them with clients. And I believe that's all the content that we have for you guys today. So we can open it up if anyone has any questions in the last 5 minutes. All right, I'm not hearing anything. So if you have questions, feel free to unmute yourself and ask them or pop them in the chat. Otherwise, I just want to say thank you guys again for coming. I do really hope that you guys are taking care of yourselves. I think, you know, things are just really exhausting now, both with the ongoing pandemic, but also just with kind of the horrors that we see unfolding day in and day out in our nation. There's nothing new, but it's still exhausting and disheartening and shouldn't be occurring. And so hope you guys are taking care of yourselves. Hope you know that you guys are truly valued. You can always reach out if you need anything. And with that, not seeing any questions, then I just want to say have a wonderful weekend, get some rest. Hope you can recharge. And I appreciate all of you guys. Thank you.